My name is Ryka. I'm a recent high school graduate, so today I'm going to be talking about how precision medicine is the future of mental health care. Are you guys able to see the screen?
Yes.
Okay. So before we dive into what precision medicine is, I just want to talk about the problem with the current approach to medically treating mental disorders. Generally, a doctor prescribes medication based off what is the best medicine for most patients. The problem here is that for some patients, the treatment considered the best will be ineffective. So this leads to long periods before the patient is able to actually experience the benefits of the treatment. So if the treatment is not appropriate for the patient, then there can be a significant risk of getting side effects. And due to these frequent medication adjustments, it leads to increased costs, medication due to medication changes. So all this contributes in a way to the stigma that's associated with having mental illness and receiving help. So this brings us to precision medicine and how it's relevant in this scenario. Uh, so precision medicine, it's a very individualized form of medicine that uses a person's genetic information, the environmental factors, and their overall lifestyle to, individualize their treatment. So right now, like current approaches are geared towards the average patient. What do I mean by the average patient? It means that, for example, in a group of like 100 patients, we say that 80 patients respond well to a certain treatment. Then we say that the average patient responds well to treatment. But we're disregarding the 20 people who did not respond well to the medication. So what precision medicine does is that it takes into account every individual difference, and it sort of like modifies the treatment based on individual characteristics. So why do we need it in mental health care? So because one, it's mental disorders are complex. There are a lot of factors that you have to account for, and those factors can be different really to a great degree individually. And then a lot of these psychiatric drugs, they have serious side effects, and they could lead to, like added conditions, like drug addiction, just something that you don't want when you are receiving a treatment. So all this calls for tailoring treatments. And implementing precision medicine can lead to like more effective treatments, decreased costs, like the overall cost of the treatment will be decreased, and it will lead to drug repurposing, which means that a variety of drugs, I mean, like one drug can have a variety of uses for like a variety of patients. So precision medicine right now, it's being implemented in 3 different ways. Firstly, through brain imaging technologies, then through pharmacogenomics, and then through AI. So what exactly is pharmacogenomics? So we all are like a little genetically different, and that small genetic difference makes us all a bit different to the way we respond to drugs. So I'll just explain this with the help of an example. So this is Sarah. This is an example based on an actual research study. So she gets diagnosed with like depression, major depressive disorder. So the doctor wants to prescribe her antidepressant X because it's considered the best medicine for people of Sarah's age and other conditions that she has. So but then she goes like for pharmacogenetic testing, and they find out that she has a gene variant that causes her to be a poor metabolizer of antidepressant X. So now people with that gene variant, they're known to have like higher levels of antidepressant X, which will cause increased side effects, and it will reduce the effectiveness of the antidepressant. So the doctor considers giving her antidepressant Y, and it actually works because based on pharmacogenetic data that they collected, it kind of connects with Sarah's individual like genetic characteristics. So it's also being done through like AI and brain imaging technologies. So like a recent study, what they did was that they created like a AI machine learning algorithm where they like fed it some MRI brain scans and clinical data, and then that AI could predict the effectiveness of the antidepressant. It did it by like seeing the level of blood flow in the brain in the emotional regulation center of the brain. So if there's more blood flow in that area of the brain, that means that it's going to be working. It's going to be effective in the next 8 weeks. And that can really help knowing, instead of spending more time knowing if this antidepressant works or if that one works. So some of you might think that these genetic sequencing things, it might be a bit expensive, but just to put it briefly, it's come down by like from $1 billion to a few $100s. I know the technology has come down this far, and we would be saving up a lot in instead of like investing in potential treatments that could be wrong. And finally, sorry, can you just give me a few seconds? I'm nearly done.
Yeah, go ahead.
So so like traditional one size fits all research is like not always inclusive. It's not like inclusive of all populations. It's mostly geared towards like the majority population because it's based off data that's mainly collected from majority population. So now the promise of precision medicine is that every patient, regardless of their background, will get a treatment that's effective and tailored to their individual requirements. But as I said, that this can be done only if you get like a lot of data from those minority populations. The NIH is doing this already through their All of Us research program. You guys could also like get involved. I have a link in my PPT. So like what they're doing is that they're collecting a lot of health data from diverse backgrounds, and it's hoping to bridge that disparity in data from those populations. Yeah, so just to conclude, that precision medicine, it is really the future of mental health care because mental health care requires a really holistic approach. And I think that precision medicine can do that. Yeah, thank you. Does anyone have any questions?